New guidance from the CDC is changing the rules about quarantine after you've been vaccinated. But as COVID-19 specialist Amanda Decker explains, the new rules only apply to certain people and only for a specific amount of time.
The United States reaches a milestone. 10% of the country has now been vaccinated against COVID-19, but that may come with a false sense of security about spreading and catching COVID-19, and that's why the CDC is now releasing some new guidelines to follow once you have received both of your shots. Up until now, the agency had recommended a 10 to 14-day quarantine window for anyone, vaccinated or not, who may have been exposed to the virus. With the new recommendations, if you've received both of your shots, you can skip quarantine, even if you have been around someone who was confirmed positive. But that advice is only for those who meet certain criteria. You can skip quarantine after potential exposure to someone with COVID if it's been at least 14 days since your second vaccine shot. Right now, the CDC says the no quarantine recommendation only lasts for 3 months after that second shot. But that time frame could get longer as we start to learn more about the long-term effects of the vaccines and the virus. Health experts say the risk of transmission after vaccination is still unknown, but these vaccines have shown they can prevent symptomatic cases of COVID. Even if you've received the shots, you should continue wearing a mask in public and practice social distancing. On average, about 1.5 million doses are being administered each day across the country, but federal health officials say we need somewhere around 80 to 85% of people in the U.S. to get vaccinated before we reach herd immunity. So here's a look at when that could happen. If we continue at the current pace of distribution, about half of the country could be vaccinated by the end of June, almost 90% of the country by mid-November. If another company like Johnson & Johnson has their vaccine approved, that would help get us to that point much faster. Now, the CDC says anyone who has been vaccinated against COVID-19 should still keep an eye on themselves for symptoms, monitor those symptoms, and contact your doctor and get tested. If you do believe you may have been exposed to COVID again, you should still quarantine if you do experience symptoms, even if you have been vaccinated. I'm COVID-19 specialist Amanda Decker reporting.